were used. You could unmute and just give me an answer. I'll give you a couple seconds.
The Tuskegee syphilis study.
That's correct. Thank you for that. So there are a few more, but I will definitely touch on that one.
Yeah, yes.
Yes.
That was what I was going to say. Yeah.
So some cases that come to mind, the case of Henrietta Lacks. She was an African-American woman whose cancer cells are the source of invaluable HeLa cell line. Before her death in 1951, doctors who treated her at Johns Hopkins in Baltimore, Maryland, they extracted cells from her tumor without her consent. And this was legal at the time, but in retrospect, it was considered unethical. Also, the Nazi medical experiments during World War II, where Nazis performed medical experiments on Jewish adults and children who were imprisoned in concentration camps. And of course, the Tuskegee syphilis study. So the infamous Tuskegee syphilis study is an example of a study where ethical considerations did not exist. This unethical study at Tuskegee Institute in Alabama lasted for 40 years, between 1932 and 1972. The study was supposed to observe the natural history of untreated syphilis. As part of the study, researchers did not collect informed consent from the participants. They also did not offer treatment even after it was easily available. So this unethical study was exposed in 1972, and this led to its termination and significant reforms in medical ethics. In 1997, President Clinton issued a formal presidential apology for the atrocities resulting from this study. The Tuskegee syphilis study significantly changed research practices through the creation of institutional review boards and the Belmont Report, which outlines ethical principles for research involving human subjects. What is an IRB and its involvement in human subjects research? So IRBs were established to safeguard the rights, safety, and well-being of individuals participating in research studies. And their key functions include ensuring ethical conduct, protecting participants, complying with regulations, monitoring ongoing studies. Let's watch a short video that explains more about the IRB. Play. I'm trying to get this to play.
Did we do that?
Yeah. Okay. So let's just skip that for now. I don't know why it's not playing. We will just move on. Okay, so let's talk a little bit about the importance of ethical considerations. Okay, research that involves human beings carries inherent risks, ranging from physical harm to psychological distress and breaches of privacy. Ethical research practices prioritize the well-being and rights of research participants, and failure to uphold ethical standards can result in harm and participants and damage to researcher credibility. So regulatory frameworks provide guidelines for ethical conduct and data privacy protection in research. So let's go back a little bit in history and take a look at events and regulations enacted to protect human subjects. So in 1979, the Belmont Report was published in response to the widespread concern about ethical violations in research, and most notably what happened with the Tuskegee syphilis study. The three foundational ethical principles outlined in the 1979 Belmont Report are respect for persons or autonomy, beneficence, and justice. These three principles were touched on a little bit in the video that didn't play, but we'll go over them right now. Okay, so respect for persons, this involves two ethical considerations. One, that individuals are and should be treated as autonomous agents, and their preferences and choices about their life must be recognized. Also, individuals with diminished autonomy due to youth, illness, mental disability, or restricted liberty, example, prisoners, should receive additional protections. This is why receiving informed consent from research subjects is so important. Individuals have the opportunity to choose whether or not to be involved in research. Another ethical principle is beneficence. This involves two considerations. One, the maximization of possible benefits for society and subjects, and two, the minimization of possible harm to subjects. Investigators, institutions, and sponsors must always strive to design and conduct research studies so that these obligations are met. And then justice. Justice is articulated in the Belmont Report as fairness in distribution of research benefits and burdens. In other words, the selection of research subjects and the distribution of research risks and benefits must be fair and equitable. Investigators must not offer potentially beneficial research only to some groups or select only accessible, vulnerable, or disadvantaged groups for research that involves high risk or little prospect of direct benefit. So a cancer research study should actively recruit participants from diverse racial and socioeconomic backgrounds, ensuring that the potential benefits and risks of the treatment are fairly distributed across different populations. A major federal policy that sets the standards for protecting individuals involved in research is the Common Rule. The Common Rule was first published in 1991. It governs the ethical review of biomedical and behavioral research involving human subjects in the United States. Relatively recent revisions enacted in 2018 included streamlining research regulations to improve protections for human subjects, also a revision of informed consent requirements, the expansion of exemptions, and then the simplification of review processes. So researchers working with the FDA regulated products must adhere to both the Common Rule and the FDA's regulations. The Food and Drug Administration protects public health by ensuring the safety, efficacy, and security of human and veterinary drugs, biological products, medical devices, food, cosmetics, and products that emit radiation. The HIPAA Act, the Health Insurance Portability and Accountability Act, HIPAA, Act of 1996, is a U.S. federal law that protects sensitive patient health information from being disclosed without the patient's consent or knowledge. So researchers must comply with HIPAA requirements when handling PHI to protect patient privacy. An example is a clinic study involving patient medical records must adhere to HIPAA regulations to prevent unauthorized disclosure of sensitive information. So the following are subject to privacy rule and considered covered entities in HIPAA. We have our health plans like your health, dental, vision, and prescription drug insurance, healthcare providers who electronically transmit health information in connection with certain transactions like your insurance claims. There are healthcare clearinghouses who receive identifiable health information when providing processing services to a health plan provider or business associate. And then there are healthcare business associates who are not really employed in the field of covered entity, but they work using individually identifiable health information to perform functions for a covered entity. For example, a claims processing and data analysis. You have to keep in mind that all of these entities have your protected health information and have to follow HIPAA regulation to keep that information safe. So there are 3 rules of HIPAA. They include the privacy rule, the security rule, and the breach notification rule. So the privacy rule, it protects individuals' medical records and other personal health information, and it limits the use and disclosure of PHI by covered entities, such as the healthcare providers and health plans. The security rule establishes national standards for the security of electronic protected health information, and it requires covered entities to implement safeguards to protect the confidentiality, integrity, and availability of electronic PHI. And then lastly, the breach notification rule. This estimates the risk associated with the unauthorized access, use, or disclosure of PHI. It identifies the affected individuals and provides timely notifications. It also ensures that the notifications contain necessary information such as a description of the breach, the type of PHI involved, and steps individuals can take to protect themselves. So HIPAA defines protected health information, or PHI, as any information that can identify an individual, is relevant to a person's physical, mental, or mental health treatment or payment for healthcare services, or any information that was created, used, or disclosed in the course of providing a healthcare service. So this slide shows categories of protected health information. It shows names, locations, dates, account numbers, for example. Some of them that aren't as obvious as others, but they are all PHI. Okay, I have another video. I'm hoping that it plays. If not, we will just move on. So in human subjects research, there's a risk of unauthorized access disclosure or misuse of participants' personal information. It is important that researchers prioritize robust data protection measures to ensure ethical and legal compliance when conducting human subjects research. So we'll start this section off with a short video on protecting your privacy in human research. Although this video is targeted at the research subject, it highlights important information for the researcher. So let's see, fingers crossed that this plays.
Hello. The HHS Office for Human Research Protections, or OHRP, made this video to help you learn more about protecting your privacy if you participate in research. Why do you need to know about privacy? Data security breaches have impacted millions of people. These breaches include events in which people's private information is disclosed without their permission. Sometimes this happens by accident, and sometimes it is the result of hacking or other criminal activity. It can happen to information held by your bank, internet provider, or hospital system, and it can happen in research too. If you're thinking about volunteering for a research study, you probably have questions about what being in the study would mean for you. You should talk to the researchers about how they plan to use and protect the information they collect about you. This is important because many research studies collect information that you'd normally want to keep private. Private information is information about you that you expect others don't normally have access to. Generally, your health information and medical records are private, and access to them is protected by laws and regulations. Also, you may want to keep something private because the information could be embarrassing. For example, that you like to binge on unhealthy snacks. In addition, some information may be sensitive. This is information that could put you at some risk of harm if other people were to learn about it. For example, if you have a history of illegal drug use, this would be sensitive information because it could cause you legal trouble or endanger your job. As a research volunteer, you may be willing to share certain information with researchers that you still don't want other people to know. The research team has a responsibility to protect your information, and they do this by following procedures to keep your information confidential. If you are thinking about joining a research study, you can ask researchers how they plan to protect your privacy and keep your information confidential. Researchers should have a plan to protect your information when they collect and use it for the research study, when they store it, and if they share it with other researchers. Let's think about this a little more. Protection when collecting your information. First, researchers can protect your privacy by collecting your private setting, such as an office, a medical exam room, or your home. This is even more important if researchers plan to ask you sensitive questions. Another way researchers protect your privacy is to collect your information anonymously. For example, they may ask you to answer questions on a computer or tablet without giving information that can identify you, like your name or address. This way, no one would know which answers belong to you. You can help protect your own information too. For example, if you are answering research questions on a computer, especially if you're using a public computer like at the library, check to make sure that no one can see what you are doing. You can also ask a librarian about secure settings on the computer. Make sure you log out and close the computer program when you're done. Protection when storing your information. Research information is commonly stored on computer systems protected by passwords, encryption, or other security measures. Passwords limit who can access the information. Encryption controls who can see your information by making it unreadable to people without permission to see it. Another common way researchers protect your information is by separating the information that can identify you from the research information you gave them. They then label your research information with a code or reference number. That way, researchers won't know what information is yours. In some studies, researchers might keep a list that links your identity to the code so they can contact you again if needed. In these cases, they protect the list by limiting access and keeping it separate from the research information. Protection when sharing your information beyond the research team. Information collected for one research study can be very useful for other research. For example, information collected to study the spread of COVID-19 could later be used by researchers to study which patients would be most likely to end up in the hospital. When researchers ask for your consent to participate in a research study, they should also tell you if they plan to use or share your information for future studies. If the information they share can identify you, they generally ask for your permission before they share it. You have a right to know how researchers are going to protect your privacy. If it is not clear, do not be afraid to ask. We hope this video helped you learn more about privacy during participation. OHRP has created a website called About Research Participation to help you learn more about participating in research. The website has many helpful resources, including videos that cover topics such as informed consent for research and research with medical records and samples from medical care. We encourage you to check out the OHRP website at www.hhs.gov/about-research-participation to find other related resources.
Okay, great. So the message from the video makes us think about nature of concern. And this refers to the specific type of potential risk or ethical issue that could arise from a research study involving human participants. For example, physical harm, psychological distress, privacy breaches, or a lack of informed consent. So ethical principles have evolved over time to accommodate changing research landscapes and societal values. And there are contemporary challenges surrounding the use of big data, genetic information, artificial intelligence in research, conducting research with vulnerable populations in digital spaces, ensuring informed consent in complex studies, and navigating privacy concerns with wearable technology and data collection in daily life. So as you can see, there are advancements in technology and research methodologies, and this has introduced new complexities, raising a lot of questions about the adequacy of the existing ethical frameworks. Okay, so let's take a look at clinical trials and informed consent. So clinical trials require robust, informed consent processes to ensure that participants fully understand the nature of the research, potential risks, and benefits. Challenges arise in obtaining informed consent, particularly in complex trial designs or emergency settings where traditional consent procedures may be impractical. So in research involving biospecimens and genomic data, there are also privacy and consent issues. And this is mainly due to highly personal nature of genetic information, which can reveal sensitive details about an individual's health, their ancestry, and potential for future diseases, and making it crucial to obtain informed consent that clearly outlines how the data will be used and protected. Clinical trials conducted in emergency settings face unique challenges in obtaining timely informed consent due to the urgency of medical interventions. Examples are research studies conducted on patients experiencing life-threatening situations where immediate interventions is required, like trials evaluating new treatments for heart attacks, strokes, severe trauma, major bleeding events, severe allergic reactions, or acute respiratory distress syndrome. Alternative consent models such as deferred consent, where the patient is enrolled without consent, but consent for further participation in the trial is sought as soon as the patient regains capacity, or community consultation to gather input, concerns, and perspectives on emergency response efforts. This may be necessary to balance ethical requirements with the need for rapid intervention. Okay, let's move on from informed consent and talk a little bit about health data that's generated by the healthcare system. So health data include clinical data recorded by healthcare professionals or medical equipment during patient care in hospitals or clinics. Examples are electronic medical records or EMRs, prescriptions, laboratory data, pathology images, radiography, and payer claims data. Clinical data is essential for tracking patients' health conditions over time and facilitating clinical treatments. So what are the privacy concerns? So they include the fact that clinical data contains highly sensitive information. It is mainly used for internal purposes within the medical institutions, but it also holds value for secondary usage. And secondary data use is where data are used for purposes other than patient care, such as research, education, public health, often requiring the sharing of health data with universities, pharmaceutical, and insurance companies, and more. And health data is also generated by consumer health and wellness industry. And this category comprises of health data generated outside traditional healthcare settings, often by consumers themselves using various technologies and devices. For example, data from wearable fitness tracking devices, medical wearables like insulin pumps and pacemakers, health monitoring apps, and online health consultation services. So regarding privacy concerns, these data are often commercially used and may be less accessible for improving public health due to privacy protection measures. So let's look at a summary of clinical data and consumer health data. And this table shows that clinical data refers to detailed medical information collected directly from a patient's healthcare records or medical equipment, whereas consumer health data is broader and is generated from things like wearable devices and health apps. Data are often collected by companies for marketing and research purposes and is not necessarily as detailed or verified as clinical data. Clinical data can be generated by healthcare system, whereas consumer health data by wearing a Fitbit, for example. Data details for both can be similar, although clinical data is more professional and private, while the consumer health data can include much more details like exercise data and online health consultation. It is less standardized and less private. Let's examine the regulations concerning privacy protection and health data across different jurisdictions across the world. So in the US, we have HIPAA, Health Insurance Portability and Accountability Act, and the HITECH Act. So HIPAA, along with the HITECH Act in the US, primarily focuses on protecting personally identifiable health information, PHI, within the healthcare industry. The HITECH Act strengthens HIPAA's privacy regulations, particularly in electronic transmission of health information. HIPAA protects health information, but not other types of consumer data. CDR, which is the Consumer Data Right regulation in Australia, this sets controls on how health information in systems can be collected, used, and disclosed. PIPEDA, Personal Information Protection and Electronic Documents Act in Canada, applies to all personal health data and goes beyond HIPAA requirements in certain areas. It places emphasis on consent for data processing, including data generated by mobile health apps. The GDPR, the General Data Protection Regulation in the EU, is a comprehensive data protection regulation covering health data and all other personal data. Regulations in China are scattered, and there are scattered regulations across various laws in China. And these regulations focus on prohibiting privacy disclosure and restrict health data reuse to specific purposes like medical care, teaching, and academic research. Okay, now we'll look at data privacy strategies for clinical data. So the hierarchical access rating system is a privacy strategy for clinical data that uses a tiered structure to control data access based on user roles, data sensitivity, and trust level. This approach is important for protecting sensitive patient data while enabling authorized personnel to access the information they need for their roles. The level of data de-identification is matched with the trustworthiness of the data recipients. So in the real world, we can see doctors may have access to patient records, while nurses can access specific parts of the records related just to their tasks. Also, researchers can access anonymized data for research purposes, while administrators may have access to all data for operational purposes. So it's really role-based. Now let's examine data privacy strategies for genomic data. Genomic data presents unique challenges because it has so many features and qualities, and the potential for re-identification, and it requires more specialized approaches to data privacy beyond traditional methods. And these strategies primarily focus on obtaining informed consent from individuals. Individuals must understand how their genomic data will be used, shared, and protected. Employing rigorous data access control mechanisms means who can access what type of data. Also, anonymizing data through techniques like de-identification, where you remove or mask identifying information from data to prevent the identification of individuals. Also, there's a focus on utilizing encryption for data storage and transmission to prevent unauthorized access. And also adhering to strict data usage limitations. We use genomic data only for the purposes specified in the informed consent process. An example of the genomic data challenges is recently the company 23andMe, they filed for bankruptcy, and the major concern is the privacy and security of the sensitive genetic data of its more than 15 million customers. So here are some additional data privacy strategies applicable to all clinical data. A strategy of data minimization. So this means that we only collect what's necessary and we limit retention. So we retain data only as long as it's needed and then securely dispose of it. Regularly review data. So we periodically assess whether the collected data is still relevant and necessary. And if it's not, we dispose of it. Some data security measures include encryption of sensitive data, access of control, data masking, and anonymization, having regular audits, and incident response plan. You have to have a clear plan for responding to data breaches or other privacy incidents. One other strategy is the privacy policies and transparency. Here we obtain clear and informed consent and understandable privacy policy from users before collecting their data. Also be transparent about data handling practices and inform users about their rights. Now we'll look at strategies for sharing models without exposing data. And these are the privacy preserving data sharing techniques. So to share machine learning models without exposing the underlying data, the most common method is federated learning. And federated learning is a machine learning technique that allows multiple entities to train a model collaboratively while keeping their data decentralized. This slide shows how a hospital, a medical center, and a cancer treatment center are training a local model while keeping their private data on premise. So the federated learning system has many benefits, and they are the preservation of data privacy. Data owners retain control over their data, minimizing the risk of privacy breaches during model training. Another benefit is compliance with regulatory environment. So the effective measures to protect data privacy align with increasingly stringent data privacy and security regulations worldwide. And the third benefit is it enables collaborative research. So researchers can collaborate on model development across institutions without sharing sensitive patient data, and this promotes advancements in healthcare research. So another privacy preserving data sharing technique is data anonymization. This is a process that removes or alters personally identifiable information from data sets to protect the privacy of individuals. And this slide lists some data anonymization techniques that can be employed at different levels to mitigate the risk of privacy disclosure, extract knowledge from the identified data, and shared models without exposing sensitive information. Data suppression is a method used to protect the privacy and confidentiality of individuals by withholding or removing specific data points, especially in public reports and data sets, to prevent the identification of individuals or small groups with unique characteristics. So on the slide, you can see there are asterisks in the cells where data are suppressed to protect privacy. Okay, so let's look at generalization methods as another technique of data anonymization. In data privacy, generalization is a technique where specific data values are replaced with broader categories or ranges, essentially blurring the details to make individual identities less identifiable while still preserving the overall data patterns and usability. Abbreviation is a generalization method, and this refers to the practice of replacing specific detailed pieces of information with a more general abbreviated version to protect individual identity while still retaining some data utility. For example, replacing a person's exact age with an age range like 30 to 39. Another data sharing technique is synthesization methods. The objective is to generate synthetic data from aggregate statistics to preserve confidentiality and enable valid inferences. And implementation of this may take the form of text generation of a synthetic clinical notes for training natural language processing or NLP models. And this ensures data privacy while increasing data availability. Data obfuscation, while related to data anonymization, is a much broader term and is the process of transforming sensitive information to make it difficult to interpret while maintaining its usability for authorized purposes. This is usually performed to protect personally identifiable information from malicious threats during various stages of data handling. Data mining is the process of sorting through large data sets to identify patterns and relationships that can help solve problems through data analysis. How can privacy of individual records be preserved during data mining? So privacy preserving data mining involves various techniques and methodologies and can be explored from different user roles, such as the data provider, the data collector, the data miner, and the decision maker, each with its own perspective on security and privacy concerns. So the association rule in mining is a machine learning technique that finds patterns in data by identifying relationships between variables. A simple illustration here on the slide suggests that customers who buy milk and bread are more likely to buy cheese. An example in healthcare would be identifying that patients diagnosed with high blood pressure are also likely to have elevated cholesterol levels. And this correlation presents a privacy challenge. Another method of privacy preserving data sharing techniques is the cluster analysis, which groups records into clusters based on similarities. And there's also the approach of data transformation, and this applies techniques to transform data to protect privacy while performing clustering. Secure multi-party computation collaborates among multiple parties to perform clustering without sharing individual data. And the last part of this presentation, we're going to look at privacy versus accuracy. Data privacy protection is crucial, but there is often a compromise between privacy and accuracy. Pursuing absolute privacy may lead to unusable data, while sacrificing too much privacy may compromise individual confidentiality. In real life example, where a patient's medical record accurately states that they have a condition like HIV/AIDS, but due to privacy concerns, this information needs to be masked or redacted when sharing the record with a non-essential healthcare provider. This can potentially impact the accuracy of a holistic view of the patient's health if the relevant information is not accessible to all treating clinicians. So risk mitigation methods, privacy-preserving data mining, and federated privacy-preserving data mining are all examples of methods and techniques developed to address the balance between privacy and accuracy. Risk mitigation methods focus on anonymizing private or sensitive information to reduce the risk of re-identification. However, overly aggressive anonymization can severely impact data quality, rendering it less useful for analysis. Privacy-preserving data mining aims to process privacy-scrubbed data and extract knowledge or build AI systems. However, the effectiveness of these approaches depends on striking a balance between privacy protection and data utility. And lastly, federated privacy-preserving data mining offers a promising direction for reconciling privacy and accuracy. By conducting data mining or learning within individual institutions and then collaborating in a federated manner, it avoids the need to share sensitive data externally. So in practical scenarios, there is often a trade-off or compromise between privacy and accuracy. Pursuing absolute privacy may lead to unusable data, while sacrificing too much privacy may compromise individual confidentiality. So to summarize, the key points of privacy versus accuracy include the following. Privacy protection, and this is essential for safeguarding individual confidentiality and ensuring compliance with regulations. Then data quality. Overly aggressive anonymization can degrade data quality, affecting the accuracy and effectiveness of analysis. And then there's a trade-off. We must strike a balance between privacy and accuracy, considering the requirements of privacy level and utility level. And then lastly, the federated approach. And this enables collaboration on privacy-preserving data mining without sharing sensitive data externally, offering a more acceptable compromise. And that's it. That's the end of the training. Does anybody have any questions? Okay, thanks for joining.
I have
We
one.
will send notification for next week. Hopefully we can have it next week. I know we didn't have the EDA 360 for a few weeks. Hopefully we will have it next week and the notifications will be sent out.
Thank you, Nicole.
Okay, thank you.
Hi, this is Alexia on the call. Will the slides be made available?
No, this is something that we present occasionally, more than once a semester, so we don't usually make these slides available.
Okay, thank you.
You're welcome.